As Americans brace for the medical and economic impacts of the coronavirus, U.S. officials are trying to encourage preparedness without setting off a panic. Joining us now, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. Doctor, welcome back to Fox News Sunday.
Good to be with you, Chris.
What's the latest on the spread of the coronavirus across the country and the number of deaths here?
Well, we're having, obviously, an acceleration of cases now. If you look at it every day, we get more and more. We have somewhere around 350, probably going to be close to 400 if it isn't already there. We have at least 18 deaths, and they keep coming on every day that goes by. What we're seeing is what is called community spread in certain regions of the country, particularly in the area of Washington State, Seattle. Yeah.
So, Italy just announced that it is going to lock down an entire region of northern Italy that includes Milan and Venice, with a quarter of the population, millions of people. Nobody's going to be allowed, except under extraordinary circumstances, to go in or to go out.
Right.
Could that happen here?
You know, we have to be realistic. I don't think it would be as draconian as nobody in and nobody out, but there'll be, if we continue to get cases like this, particularly at the community level, there will be what we call mitigation, where you'll have to do essentially social distancing, keep people out of crowded places, take a look at seriousness. Do you really need to travel? Those kinds of things. And I think it's particularly important among the most vulnerable. And that's the thing that the CDC and the State Department are going to be making some recommendations about, how people who have underlying conditions, those are the most vulnerable ones, particularly elderly with underlying conditions, heart disease, chronic lung disease, diabetes, to do right now, not wait, but right now, to sort of take a look at things that are at high risk, crowded places, getting on airplanes, and absolutely don't get on a cruise ship.
So I want to press this question, though, of Italy.
Right.
Could you see a situation, you know, a lot of talk about Seattle and what's going on there, where a city is shut down, or a state or a region is shut down, and you basically just say, and in the case of Italy, it's till April 3rd, nobody in, nobody out?
It's possible. I think what you need to do on real-time basis, and that's the reason why we evaluate it literally every single day. You know, you don't want to alarm people, but given the spread we've seen, you know, anything is possible. And that's the reason why we've got to be prepared to take whatever action is appropriate to contain and mitigate the outbreak.
Okay. Meanwhile, the cruise ship, the Grand Princess, the latest call is that it has 3,500 people on it, that it's going to dock perhaps as early as tomorrow at a non-occupied dock in San Francisco Bay. People are then going to be taken off the ship. They're going to be sent to quarantine, California people to a base in California, the others to a base in Georgia. Are you comfortable with that, or would you prefer to see those folks stay on that ship?
No, absolutely not. I recommended very strongly in our meetings that we get those people off that ship. We don't want to have a repeat of what we saw at the Diamond Princess, where the ship became almost a hot spot of transmission. Now, I feel strongly about getting them off there and getting them under the appropriate quarantine and or care for those who are sick.
There has been some confusion about the response in this country to the disease. First of all, when a vaccine will become available. Take a look.
I've heard very quick numbers, a matter of months, and I've heard pretty much a year would be an outside number.
When is it going to be deployable? And that is going to be at the earliest a year to a year and a half, no matter how fast you go.
Realistically, what's the earliest that a vaccine will be available for Americans to take?
Yeah, I think people need to appreciate the difference between a vaccine that you've proven works. That's going to take a year to a year and a half. When you can get it scaled up, and that's the reason why we've met with the pharmaceutical companies, because once you show it works, then you've got to scale it up to hundreds of millions of doses. We are talking at least a year to a year and a half, at least, at best.
You sound like you think it's longer than that.
Well, you know, it might be with regard, I mean, Chris, the test we're doing right now, getting it into phase 1 trial, is the fastest we've ever done. Don't confuse that with when you could put it in someone's arm in a deployable way. So I think that we really need to realize that for now, the answer is not going to be a vaccine. If, in fact, we go into a cycle where we come back next year, then we likely would have some opportunity for a vaccine.
There have also been contradictions about when and how many people can get tested. Take a look at that.
Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. Anybody that needs a test gets a test.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
Can anybody who needs a test get a test now?
The fact is the tests are out there. There was a misstep early on with regard to the test, namely a technical difficulty. But right now, about 1.1 million tests are out there now. There'll be an additional about 640,000 on, let's say, Monday, and then at least another 4 million, particularly now that we're engaging the private sector. Now, when you say that, they're out there. If you go to a doctor, it's up to the doctor to order the test. And if that happens, a person should have a test available. But it's no doubt, Chris, you have to be realistic. Early on, there was some missteps that delayed it.
I want to pick up on that, Doctor, and the question of testing. I want to put some numbers on the screen. As of Thursday, the CDC had tested only 1,583 people. In California, only 516 tests. Meanwhile, in South Korea, more than 66,000 people were tested within a week of the first case of community transmission, and they can now test 10,000 people a day. Why are we so far behind?
You know, I mean, it gets back to what I said in the beginning, that the CDC made a test. There was a technical glitch there. The CDC provides tests for the public health groups in the state and local. What we really need to do now, which were the numbers that I mentioned to you, is to get the private sector involved so that you could literally flood it with millions and millions of tests. That is happening now. But in fact, the American people need to realize that in the beginning there was a glitch, and we need to overcome that now.
You spoke with Politico recently, and I want to put up part of what you had to say. You said you should never destroy your own credibility, and you don't want to go to war with the president, but you've got to walk the fine balance of making sure you continue to tell the truth. You have had to correct the president a few times, especially on the availability and the schedule for vaccines. Where do you personally draw the line between reassuring people but staying away from spin?
Yeah, I try as best as possible, and I think I succeed over many years of staying away from spin and just give people the information that you need based on evidence and hard facts. When you have the evidence, you give it as it is. If you don't have all the evidence, because we're in a dynamic situation, you use your best judgment in recommendations and guidelines. But you must always, always be truthful with the American public.
There's a story today on AP that the White House overruled the CDC, which wanted to warn elderly people and people in physically fragile conditions not to get on commercial airplanes. One, do you know whether that's true or not? And two, what would you tell a relative of yours who was in either in that class, either elderly or physically fragile? Would you say stay off airplanes?
No, well, here's the deal. I can tell you right away, Chris, that no one overruled anybody about saying that. So let me say it loud and clear now. The CDC has a health alert, and the State Department has more of a travel alert. Right now, I'm telling the American people, based on everything that's agreed upon in the task force, that if you are an individual who has an underlying condition, particularly an elderly person with an underlying condition, right now, not wait, you should start to distance yourself from the risk. Crowds, getting on a plane, on a long plane trip, and above all, don't get on a cruise ship. That is a health issue. What the State Department is saying from a logistics standpoint, don't get on a cruise ship, because you could come out, have a person on there, then all of a sudden you find yourself not being able to get back and quarantine. No one has told us not to say that, and I'm saying it very clearly now on your show.
Finally, I have noticed you've been all over television the last few days. You have a bit of a raspy voice. Have you tested yourself or had yourself tested for the coronavirus?
No, because I have not been at risk. My raspy voice is the fact that I'm talking too much on TV shows.
Well, keep doing it. You are a voice of reason and science and authority, and I think when people hear you, they they have reason to think they're getting the straight scoop. Thank you very much.
Thank you for giving me the opportunity, Chris.
Always good to talk with you, sir.